It is AM Knoxiana here on this Monday. Thanks for joining us, the 1st of November. And we appreciate you joining us. And don't forget, throughout this week, Kevin Henford from Knox County Veteran Services will be with us tomorrow. And we're looking forward to having him on with Mayor Matt Starr. We'll follow him, and then the library on Wednesday, and then Thursday, Main Street, Mount Vernon will be on with us, and we'll talk some food for the hungry as they're supposed to be kicking off today. So a lot going on this week, and we look forward to having you listen in. And you're probably going, what is going on? Dr. Swetlic's in here on the 1st of November. This is not typical. But Dr. Jim Swetlic, we appreciate him joining us. You know, I was joking. Have you turned your heat on yet?
I'm sure we have.
Right. I did it for the kids.
Yeah.
But when they're not there, I turn it back off. Yeah. But then I'm cold.
I let the boss take care of that, my wife. You know, she thinks it needs to be on, I'm fine. So I don't touch that dial.
That's the way to do it. Yeah. So Dr. Jim Swetlic, Swetlic Chiropractic and Rehabilitation, just down the road from us here. You know, the running joke is that I can even get there without getting lost. So Swetlic Chiropractic and Rehabilitation. Tell us how long you've been around. Obviously, it's your namesake here. So.
Yeah, well, I've been around since over in my office here in Mount Vernon in 1986. So I graduated Mount Vernon, went to Mount Vernon, so I'm an alum from here. So we've been in practice since 86, and made a few moves between now and where I'm at now, and picked up a few extra doctors and a physical therapist. And before COVID, we were running 4 doctors strong, and then with COVID, they made us reduce the amount of people can be in our building. So currently we're just with me and Dr. Overholt and Dr. Jenkins, Dr. Jenkins is my physical therapist, and just a wealth of knowledge he is. And Dr. Overholt's been with me for 13, 14 years, and currently we're recruiting to find some new docs, another doc or two. So easier said than done this at this point in time.
Yeah, so right now, Swetlic Chiropractic and Rehabilitation, the last time you and I spoke, I think you were doing like a 7-to-1 type thing. Is that kind of what you're still
we're still in that mode at this point in time, and we're doing our best to get that opened up more and more, but a little difficult, but we'll get there.
Yeah, when we think about some of the things that you guys have, you've obviously got the physical therapy side, and then you've got the chiropractic side as well. You can do either one. Like for me, I came over and you guys helped fix my back, and I only did the chiropractic side, but you do either one, or doctor's referrals and all kinds of things like that, right?
Yeah, we do. Yeah, there's a number of people who come in for both disciplines. Some just come in for one or the other. So, a lot of times people come in for physical therapy, and then we'll roll them into chiropractic. Dr. Jenkins will decide that, hey, you'll get some good benefit on being adjusted as well, or vice versa. So, it works out really well. Bottom line is just whatever we can do to get the patient the best. With whatever discipline we want to use, the chiropractic, physical therapy, or, there's times we refer them out as well, so we're not afraid to do that.
Again, Dr. Jim Swetlic, Swetlic Chiropractic and Rehabilitation. Every time that Dr. Swetlic comes in here, or Dr. Overholt or Dr. Jenkins, I always try to make sure that I'm sitting up straight. Because I know, unlike anybody, that I just have the tendency to just to kind of slouch down and different things, and certainly it's a lot easier to just go into that mode, but that's not the right thing to do. So let's talk about posture. It's something that probably causes a lot of the issues that you probably see with people, is that they're just so consistently just having bad posture, and over time it just wears and wears and wears till they can't take it anymore.
Ideally, your head, it's supposed to be sitting squarely on top of your shoulders, so your ears should be lined up with your shoulder. And the weight of your head typically, is about 12 pounds when it's in its proper position. So you're thinking about a bowling ball, or gallon and a half of milk sitting on top of your shoulders. Now every inch or 2 inches that or every inch that your ear gets in front of your shoulder adds an extra 12 to 15 pounds of weight. So if you're sitting and the best way to see if you have forward head is, I just tell people, have your spouse or friend or someone take a picture of you from the side when you're standing, what you think is your best posture, and then you can see how far your head is actually in front of your shoulder. Or better yet, just to put your heels up against the back of a wall, stand with your back touching the wall, your shoulder blades, and then see how far your head is. Your head should be touching the wall at the same time, but probably 90% of the people we see aren't. So, we're coming out of the womb now with an iPad or with a smartphone, so we're all looking down, pretty much all day long. And so, that's why we talk about making sure if you're sitting at a computer, put the screen should be at eye level so you're not looking down. And, it's really difficult to text at eye level, but boy, you should work on that. Because the less you're slouching forward, looking down, the less stress you're putting improperly on your neck and upper back region. So, and we're seeing more and more and more and more of the forward head. 35 years when I came out, started seeing people as, probably 80% lower back, 20% neck. Now it's pretty much 50-50. So.
And is it like if you have bad posture for an extended period of time, or maybe you're on the phone for a long time, is that when you start seeing the issues? I mean, obviously, I would think that it's hard because you're trying to train your body to have that good posture. I probably don't have great posture. I try to when you're here, but
it looks good right now.
Yeah. So it's kind of a prolonged thing because your body just almost gets trained to have it like that, but you got to train it to do the right thing.
Yeah, a good thing is just kind of, roll your shoulders backwards, pull your shoulders back. Always, what's called a chin tuck. So you want to pretend like you have your favorite plate of pasta on top of your head, and you don't want that plate of pasta to fall off, so you're just taking your chin and you're just jutting it backwards. And that is an excellent exercise to do to help put that curve back in your neck and strengthen up some of those muscles that are becoming weak because of the bad posture. So even when I'm driving, I always have my headrest up and against the back of my head, so I'm doing some isometric exercises. Might as well get some exercise in when I look like a bobblehead going down the road, but definitely, helps my neck and upper back. So, because, back in the day when we used to play football, they used to say you tackle someone and put your nose in their number, which, now that's called spearing. You're thrown out every game. But
exactly.
We got a whiplash every time we made a tackle. So, thank God they don't do that anymore. But it's just an ongoing thing, So it's kind of like getting a new set of tires on your car. You're not going to go down the road hitting all the potholes, You're going to try to protect that front end alignment a little bit. So same thing with your neck and upper back. So just things to think about.
Yeah, Dr. Jim Swetlic, Swetlic Chiropractic and Rehabilitation. We appreciate him joining us. And you've talked about it before, just kind of when you're sitting down, sometimes you're sitting for a while and you just need to get up and move around a little bit and have that movement. But the other thing that you and I have talked about before is how important your core is to posture as well, right?
Yeah, it's critical because majority of people, a lot of, core is something you're going to have to work on all the time as well. And it's not really a tough thing to do, but, I like those big exercise balls just to sit on them, because that just sitting on that kind of puts your body in a little bit of a wobble. You're moving a little bit when you're sitting on that, so your core is always engaging. There's all kinds of exercise you can do with an exercise ball for your core, so you can buy one at Walmart for $10, and you almost have a whole gym just with that big old ball to sit on. So I use that every day. I love to row, so I use a rower half hour every day. And you got to really be, when you're on your rower, you got to really think about your posture too. Yeah. So you can make things worse. So we actually, like on me, I videoed myself the first few times I was rowing just to see what my posture was like. And then at home, I have my rower sitting in front of a big mirror. Not that I'm going to look at myself all day, but it just kind of reminds me, to sit up straight and pull my shoulders back. So, you can do all the right exercises, but you can do them wrong and create a problem instead of helping a problem. But it's just an ongoing thing. We can't, we got to continuously do some stretching and some exercise. Now, you don't have to, spend a lot of money, go to a big gym. You can do most of all this stuff right at home, but it's just being consistent. You just got to do it and do it and do it and stay with it consistently. It's not, because when I go to see my dentist, Dr. Martin, he doesn't say, Jim, I cleaned your teeth today, so don't worry about flossing or brushing for 6 months because you're good.
Exactly.
Yeah. So kind of same thing with your back.
Yeah.
We can adjust you and line things up, but you got to be on an ongoing, some sort of exercise program to help that out as well.
And Dr. Jim Swetlic, Swetlic Chiropractic and Rehabilitation. We thank him for joining us here on the program today. We've got more to talk about with Dr. Swetlic on this Monday. I almost said Tuesday because I'm used to it, but on this Monday, we appreciate Dr. Swetlic joining us. We're going to take this break, though. We'll come back, and more of AM Knox County is coming up. Welcome back. It is AM Knox County. It is a Monday. Thanks for joining us. I remember this time. It's a Monday, and we appreciate Dr. Swetlic joining us from Swetlic Chiropractic and Rehabilitation. We've been talking a little bit about posture and different things. And, you and I have always also likened it to almost like getting the oil changed in your car and things like that, where, if you don't do the maintenance on your body and you don't take care of yourself, then you're going to get in a situation where it's beyond repair, and then you're going to have surgery or more invasive treatment as well. So you guys offer all kinds of different things. I was on some like an inversion table where I'm like laying on the table starts moving. It kind of shocked me, but that's kind of a neat thing, and some different things that you guys are able to treat an array of issues for people.
Yeah, we have a variety of different type of physical therapy equipment, and we have tables called Spinal Decompression, and it's a updated type of traction that we use on the lower back and the neck region. Something that I actually purchased initially for myself because I've been through a few herniated discs that unfortunately I was at this point in time I'm able to avoid doing the surgical intervention just because of good chiropractic and physical therapy. And then the decompression table has been a godsend. So I use that pretty regularly, but I'm really regular with my exercise program as well. Now, so we offer that. We offer the other type of stuff: electrical stim, cold laser, ultrasound, dry needling, and then Dr. Jenkins, who's my physical therapist, he's got a PhD in exercise physiology, so he's just a wealth of knowledge on what proper exercise to do for different conditions. So we kind of go back and forth and discuss different patients, and and ultimately we just want the best program that we can set up to improve their life. So pain will definitely change your life. So, but anyway, so it's been a good ride. It's really been fun. I've had a great time. I've still got more years to go, and this is like 36th or 7th year, and I figured when I was 25, I figured I'd be riding off in the sunset, but
you can still do that if you want.
But I still like going to my office, so it's and I got a good group of people to work with. So.
Yeah. One of the things that we try to stress to people as well is that this isn't like a situation where it's like, okay, well, my back's been hurting for a long time. I'm just going to go in one time to Dr. Swetlic's office. I'll be good to go for the rest of my life. Make a pit stop, and I'm good to go. It takes time to train your body or train your muscles to do what is right when when they're all out of whack.
Yeah, because if you think about it, posture is subconscious. So we get up in the morning and think, man, I'm going to really work on my posture today. So and I'm guilty. So there'll be days I'll be working on people and think, well, I did pretty well for the first half hour. Now my posture really got terrible again. So I got to remind myself as well to look at my posture because our job's pretty physical, and there's a lot of different things that we do that we could really injure ourselves, which I have on several occasions. But the thing you got to go back to is that posture is key. So exercise and posture is so critical. And then even you got to think about it at night when you're sleeping. You don't want to sleep with 2-3 pillows piled up on each other. You want to keep your same type of posture at night when you're sleeping. You want to have your shoulders and your ear all lined up in the same plane, okay? And then people, they'll be laying on the couch with their head all propped up on the side of the couch, and probably when they're watching the Browns, they might fall asleep now and then.
Probably wanted to yesterday.
And but anyways, so it's just an ongoing thing that you got to be aware of.
Yeah, my little boy, he likes to get in bed and he'll go, I want to lay on your pillow, and I'm like, but buddy, you're gonna wreck my back because we're on the edge of the bed, and like you say, it's almost like you lay there in bed, and if you're on a funky way that you're laying, it can be difficult. Is there a best way to do it? Sleeping on your back, sleeping on your side, in these to keep yourself physically more in a better position, I guess?
Yeah, the number one thing you got to think about, you don't want to sleep on your stomach, because when you're on your stomach, it puts a lot of extra stress on your lower back, because your lower back's dipping in towards your belly. But at the same time, your head's turned probably to the right or to the left. And you wouldn't sit at home, watch TV with your head cranked to the right all night watching TV. You're going to end up with a stiff neck. So a lot of people do sleep on their stomach with their head twisted all night, and they have a lot of neck problems. So ideally, sleep on your side fetal with a pillow underneath your head. And again, you don't want it to be jacking your head up. So if you're laying on your right side, you don't want your head to be leaning way to the left. You want it to be neutral. And then you want to have a pillow in between your knees, because that takes a lot of strain off your lower back. The same thing if you're laying on your back, pillow underneath your head, just a small one, and then a pillow or two underneath your knees. You want your knees bent at night. That takes a lot of strain off the entire spine when you're laying at night. So
yeah, well, I will say that I am guilty of sleeping on my stomach. Well, and it's something that, again, self-consciously. And then my son, he likes to put his arm around me, so then I started to get to the point where I was laying on my side. But it's still, you want to just lay on your, I don't know, you get comfortable with it, and it makes it difficult there. And like you say, it can put you in a situation, especially if you sleep like that all the time, it puts that pressure on you, and then that's when you start having this back pain.
There you go. They'll say, all I did was woke up and had a neck problem. Well, how are you sleeping?
Yeah. The other thing is, you deal with like rotator cuffs and things like that too. It's not just the back and the neck issues, but the rotator cuffs and things like that, if people are having some issues, you're able to see what you can do for them and assist them in getting back to the field or back to work or anything like that. Yeah,
I see a lot of those shoulder problems. And again, it goes back to posture, because when you're sitting or doing anything, your shoulders should be, when you're looking at someone from front to back, their shoulders should be kind of rolled backwards a little bit, okay? But when you're sitting and you're working, even if you're feeding your face or working on a computer, your shoulders will roll in towards your chest, and that tightens up those shoulder muscles in the front and your chest, upper chest muscles. So that puts a lot of extra strain on those shoulders. So again, that's just another thing that we try to work on people, just stretching their shoulders, rolling them backwards, opening them up. So it's posture.
Yeah. And again, Dr. Jim Swetlic with us, Swetlic Chiropractic Rehabilitation. We appreciate him joining us. Going to ask you before, still have a few minutes left here. Are you still doing the stem cell things? Is that still an option for people?
Yeah, we're still doing some. Yeah, once a month we're doing some injections with those. I have a couple medical people come in and take care of all that for me.
Yeah. And that's kind of a last-ditch effort thing. It's not something where you're going to come in and say, hey, welcome in, you're going to get stem cells.
That's just kind of, I went down that road some years back. I tried all kinds of different natural injections and cortisone and everything, and the only thing that really helped me out was, my next step was to have shoulder replacement and 2 knees replaced. But fortunately, it's been 5-6 years on my knees. They're still doing really well after I had them stem celled, and shoulders are doing pretty well as well.
So you didn't get them replaced. You just did the stem cell thing. You didn't have to, right?
Yeah.
Oh, that's pretty cool. So, but like we say, that's kind of a last-ditch effort thing. If maybe you're looking at it and you say, hey, we've exhausted everything we could to try to help you here. Would you consider stem cells? And then that's when you guys.
Yeah, majority of people come through. They've had physical therapy. They've tried all kinds of different types of things. And so, yeah, that wouldn't be my number one treatment option. That'd be down the road somewhere.
Yeah. Do you guys still do the seminars and things for that, or is that?
We haven't lately.
Okay.
But I we're looking to start doing those again. But it's a COVID spacing.
Sure.
There's so many. The regulations are really tough. So
sure. All right. Tell us again how we get a hold of you, Dr. Swetlic, or just your office if somebody wants to see what opportunities they have or options they have, and the best way to find out more information.
Yeah, we're located just a stone throw from here on the corner of Upper Gilchrist and Yager Road at 11301 Upper Gilchrist Road, right on the corner at the 4-way stop. My website is painfree at swetlichealth.com or 392-1407, or just stop in.
Dr. Jim Swetlic, Swetlic Chiropractic and Rehabilitation. As always, thank you so much for your time. Great information once again. We appreciate you stopping by. And Dr. Swetlic will be with us here before you know it in a couple of weeks. So, well, it'll be somebody besides Dr. Swetlic, but somebody from his office will be here. So we look forward to that. But thanks for joining us here on AM Knox County. We're back tomorrow after a 23-hour break. We'll be back at 10 o'clock. Have yourself a wonderful Monday. I'm Tyler Lafayette.